Welcome to this comprehensive class member transition program policy training provided by the UIC College of Nursing. This training will address post-transition processes in the comprehensive program, including reportable incidents and mortality reviews. This training will enable comprehensive program staff to understand the processes that take place after class members have moved into the community. It will help them utilize clinical review processes effectively, including reportable incidents and mortality reviews, and complete comprehensive program documents correctly. Post-transition care management visits, policy P0.08. Care managers are responsible for conducting face-to-face visits with the class member at least weekly for the first month in the community and monthly until the class member reaches 18 months in the community. Each of these visits must be documented in the web app under Notes, in addition to any internal processes the care manager may be required to follow. Required incident follow-up visits by care managers or nursing staff must be documented within the web app as well. Post-transition changes, policy P5.1. Comprehensive program staff and UIC-Con must keep up to date on significant changes in member status after they move to the community. This includes changes in address, guardianship status, eligibility for the program, disengaging from the program, or passing away. If a class member has a change in address or phone number but is remaining in the CMTP, complete the section Change Address Phone under Post-Transition in the web app. Please also refer to policy P5.05, Decline Services After Transition, which outlines procedures for class members declining services after transition. Policy P5.06, Post-Transition Closure to Services, outlines procedures for class members who are closed to services post-transition. Additionally, policy P5.07, Temporary Out-of-Home Stay, outlines procedures for class members who have a temporary out-of-home stay. Policy P5.04, Unable to Contact Class Member Residing in the Community, outlines procedures to follow when unable to contact a class member residing in the community. Finally, policy P5.08, Documenting Post-Transition Engagement, outlines how post-transition engagement should be documented. Each prime should have an internal process recording the steps to be taken when no contact can be made with a class member who has transitioned to the community. Prime agencies should notify their assigned Organization Monitoring and Support Unit, OMSU, clinical liaison if they are unable to locate a class member in the community. OMSU clinical liaisons will guide discussions regarding the prime agency's efforts to locate and contact class members. The OMSU clinical liaison and the prime agency will discuss the agency's strategy for managing missing class members. If a class member is unable to be located for more than 60 days and the prime agency has exhausted all efforts to locate the member, in conjunction with the assigned OMSU, IDHS may allow the prime agency to close the class member's case. These determinations are made on a case-by-case basis as described on the procedures. Please use the Notes section of the web app to capture significant changes that cannot be recorded elsewhere. Reportable incidents. Policy P5.02. Reportable incidents are significant events that have the potential to negatively impact a class member's stability in the community. The comprehensive program requires that these incidents are documented and formally reviewed when they take place within the first 18 months of transition into the community. Prime agencies are responsible for documenting all elements of the reportable incident within the web app. The form requires information on when the incident took place, when the agency learned of the incident, and who was involved. There is also a space for the agency's narrative of the incident and a description of the agency's response. During the coronavirus pandemic and the restrictions associated with COVID-19, comprehensive program staff are responsible for tracking and providing immediate notification of incidents or situations related to COVID-19. These include any mortalities, hospitalizations, emergency room visits, quarantines, tests, or recoveries associated with the virus. Note that this includes situations which do not otherwise rise to the level of a reportable incident. Test results should be reported, and the class member's living situation should be specified in this table. Note that these situations must be reported immediately. There's no grace period for making these reports. COVID-related incident reports will be reviewed by UIC and IDHS, and calls will be scheduled as indicated, possibly outside of the normal weekly call schedule. Reportable incident levels. Level 1 incidents are urgent and critical incidents that must be submitted immediately, and no later than the next business day after the agency learns of the incident. These incidents include member death, suicide attempts, assault, fire starting, felony arrests, missing persons, or abuse and neglect. Level 2 incidents must be reported within 2 business days of the agency learning of the incident. These include unexpected hospitalizations or emergency department visits, injuries, re-institutionalization, fires other than those started by the member, behavioral incidents, or exploitation. Finally, Level 3 incidents include property damage or destruction, vehicle accidents, non-criminal evictions, and alleged verbal or financial abuse or fraud. COVID-related incidents must be documented within the COVID level. Agencies are responsible for submitting all incidents that take place within the first 18 months the member is in the community. Level 1 and Level 2 incidents are reviewed during the weekly clinical review calls. Level 3 incidents are reviewed in writing, but may be reviewed on a call if requested by UIC-CON, IDHS, or the prime agency. Level 1 incidents that involve member death are addressed in the mortality review process, which will be described shortly. For COVID level incidents, COVID deaths must be reported within 24 hours of learning of the incident. All other COVID incidents must be reported within 48 hours. Supporting documents should be submitted along with incident reports or as soon as the documents are available. Supporting documents include any information that can help with the clinical review of the incident. For hospitalizations or emergency room visits, discharge paperwork or aftercare summaries should be submitted whenever possible, as well as any updated laboratory or diagnostic testing results or changes in treatment plans. Provider case notes describing the incident or the agency's response are useful in understanding the event. Finally, for members who are tracking their blood pressure, blood sugar, or other vital signs, please submit these logs if they are available. These can be uploaded as within the member files in the web app. The call should include the individual who submitted the report, as well as any direct care staff who have knowledge of the member and the incident, and will also include the clinical review staff from UIC and IDHS. If additional individuals are needed on the call, such as subcontractors or MCO care coordinators, the prime agency is responsible for coordinating their attendance. Following the incident review call, a 30-day follow-up is required from the prime agency. This is completed in writing via the web app, unless it is determined during the initial call that the follow-up would be better handled via phone. The information needed in the 30-day follow-up is included in the incident summary document provided by UIC. The prime agency should submit via the web app on or before the due date. In the 30-day follow-up, the prime agency is responsible for the result of the action plan recommendations table. For each recommendation, indicate the completion status and any notes about the agency's response. At the end of the incident summary document is a 30-day email follow-up section that must be completed by the prime. This includes a brief narrative status update, how often the member is being seen, and any changes in the member's diagnosis, medication, or service plan since the initial incident review. For hospitalizations and emergency room visits, there is a table at the end of the document with some best practices for responding to medical or psychiatric incidents. The UIC clinical staff will complete the initial review columns, but the agency is responsible for completing the 30-day follow-up columns. Mortality reviews, policy P5.03. Mortality reviews are required for any member death that takes place within 18 months of transition to the community, or if IDHS requests a review of the mortality taking place outside of this time frame. The mortality review process is initiated by a report of the reportable incident in the web app, but triggers a different review process at UIC. Mortality reviews are a root cause analysis of the member's death and work to identify patterns, themes, or behaviors related to the death that could be helpful to providers in the future. The mortality review team will send a letter to the prime agency identifying the documentation that must be submitted. IDHS will request a copy of the autopsy report when applicable. The mortality review team looks at all the documentation submitted, Medicaid claims data, and the autopsy report. They also schedule interviews with the staff who worked with the member and other supports as appropriate. The findings of the mortality team are presented in a conference call format involving prime agency staff, UIC College of Nursing clinical staff, and IDHS staff. After the findings are reviewed and recommendations are made, the prime agency must provide a written action plan describing their response to the recommendations made during the review. The Comprehensive Class Member Transition Program is based on a care management model that provides transition planning, service, linkage, and quality assurance throughout a class member's transition to the community. Each class member receives monitoring and ongoing care management from their assigned prime agency for at least 18 months after transition. A class member may be closed to care management services if, after transition, they return to a long-term care setting for more than 90 days, are incarcerated for more than 90 days, or move outside of the state of Illinois. Closing a class member within the 18-month post-transition period for any other reason requires written permission from IDHS Comprehensive Program staff. Class members may be closed to care management services once they have been in the community for 18 months if they do not wish to receive services any longer. Class members may continue to receive community-based mental health services even if their care management services terminate. These class members may also continue to receive housing, rental assistance through the bridge subsidy. For a more detailed description of post-transition closure to services, see policy P5.06. Current versions of all comprehensive program policies and forms, as well as educational resources, can be found on the Colbert-Williams training website managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk email listed on that website. Thank you for your attention and efforts to ensure safe and successful member transitions.